Welcome. I'm Lee Doherty Biddison.
And I'm Carolyn Cumsty Fowler, and we are your co-hosts for the Johns Hopkins Medicine Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace wellbeing in healthcare, and we're excited to share some of what we're learning.
Thank you for joining us. Most of us know what it feels like when our well-being at work is compromised. But do we know how we got there? Is it just that it's been a tough week? Or that we didn't have time for yoga? Today, we'll take our first look at the things that really influence our well-being at work. Lee, why is workplace well-being so important to you?
Carolyn, this is such a great question. And I think I could probably talk our entire time together just on this issue. But I think there are a couple reasons. And one of them, perhaps the most important, is that well-being at work doesn't just stay at work. It has important repercussions at work, but it has impact on all of our roles. As a physician, my ability to focus on my patients, to give them my full attention and give them thoughtful care that allows them and their families to know that they are a priority and that they're getting the best care that's possible is a big part of it. But also as a parent, giving my kids the attention and the time that they need. And ultimately, we will all be patients. So how we address our well-being in the workplace is going to impact how we end up feeling, whether we're well or sick, and how quickly we end up as a patient ourselves. And then as Chief Wellness Officer, gosh, this would be something that keeps me up at night, although not too late, I hope. And something that I think about so often. And a big piece of this really is that we have the privilege, Carolyn, you and I have the privilege of working with such extraordinary individuals and who are capable of doing incredible work. And when the conditions are ripe, they can do that. But when the conditions in which they work, the systems, the structures, the approaches aren't as they should be, we're losing so much of the potential of those colleagues, both in terms of living their full lives to the best of their ability, but also their ability to impact our patients and our communities.
Right. And Lee, as you and I have said so many times when we've been chatting, our colleagues are just extraordinary, but they're not invincible and they're not a limitless resource. And I think what you've just shared just emphasizes the fact that this concept that we can keep our well-being at work or our work at work and our home at home is just completely, ridiculous. We live an integrated life at work and at home.
That's exactly right. That we need to be thinking about our lives as a whole. We absolutely have, ways in which we try to separate things, but ultimately, the what have traditionally been thought of as very separate pieces of our lives, absolutely impact each other. So, Carolyn, why don't you tell us a little bit about how you've ended up having a passion for this work? I know from the time we've spent talking that we have some of the same concerns, or many of the same concerns. But what's been your big driver to be passionate about well-being?
Well, Lee, as I've shared with you, I started my nursing career back in the mid-1970s, and this issue has been sort of in the back of my mind for decades, but I've really pinned it down in about the last 10 to 12 years. And that is the recognition of how deeply relational healthcare is. If you think about it, we don't do anything without being in a relationship with another human being, even taking a history. And then as I began to think about relationships, then it just pointed towards how well-being is so foundational to healthy relationships. In fact, one of the things that drives our well-being is a sense that we are supported and connected to other human beings. And so if well-being is foundational to relationships, then well-being has to be foundational to everything we care about in healthcare. And then the other thing that I've realized increasingly is the negative influence of the enculturated beliefs that we carry with us as health professionals and people working in healthcare. We all came into a service profession wanting to help, to make a difference. And many of us, and I know I got this lecture in my first week in nursing school, were told, you come second. The patient has to come first. If you're having a bad day, leave it at home. If your mood isn't what it needs to be, if your energy isn't what it needs to be, just deal with it. Because ultimately, you are here to serve, and you may actually have to sacrifice your time, your energy, and your well-being so that you can be a healthcare professional. Now, the evidence, as you and I know, clearly shows that this is wrong. If our well-being is compromised, our ability to serve the patients and families that we work with, and our ability to be a respectful and kind and competent colleague is compromised. But it's so hard to unlearn these beliefs. And I think actually it's sometimes harder to unlearn something than it is to learn something new. So that's where I am in my journey in understanding well-being.
So, really, we've talked about this some, Carolyn, but really to get straight to the point is we're really talking about culture change. I mean, where do you start with that? That's a tall order.
Well, I think the first place we have to start, Lee, is to get beyond the idea that we will transform well-being at work through focusing on self-care and individual strategies. Now, I want to be quite clear when I say that I think that self-care and individual level strategies are important. They're necessary for our well-being, and it's necessary that we provide opportunities for that to our colleagues. However, if we're going to change anything, especially culture, we have to be thinking about systems level change and organizational level and change that requires investment, that requires all sorts of commitment beyond just offering one-time self-care opportunities.
So, Carolyn, do I have to give up my yoga?
Well, of course not. I hope you wouldn't do that, or your healthy eating, or the walks and wonderful things you do with your family. But I do think we need to think bigger. We need to think about how do we reimagine how we do business in healthcare organizations. So, Lee, I know you've been thinking about this. So why don't you share a little about how we think about influencing well-being at the organizational level?
Carolyn, this is such a great question, and we've talked about this a lot, I know, and there are a lot of different approaches. So maybe what we can do here is just talk a little bit about the model we've been using as a team to think about this. And I, as we walk through this, I think it's helpful to remember that, the drivers of well-being are complex. The situation, the burnout and lack of fulfillment situation that we're in took us a while to get to, and it may take us a while to get out. But having a roadmap to be able to think through and to help us to guide our journey forward, I think is incredibly important. So this particular approach that we've been taking is adapted from some work with the National Academy of Medicine. And really gives us a model or roadmap for advancing healthcare worker well-being across the spectrum of roles. We have work to do, and in this case, we sort of identify 6 different spaces to keep our eyes on. The first is around advancing organizational commitment. So what are the approaches we're taking as an institution? What are our priorities? What are our key values that support healthcare worker well-being? We're thinking a lot about how we strengthen leadership behaviors. There's a great amount of data now on the association between leadership behavior and the experience of burnout or fulfillment. And so getting really thoughtful and intentional about how we build skills in this space is an important piece. Third, we actually need to keep track of what we're doing. So conducting workplace assessment. We need to know where our colleagues are in terms of fulfillment and burnout and the drivers that are associated with them, so that we can be intentional and evidence informed in terms of our response strategies. We also need to think about our policies and practices. What are the ways that we construct our work and guide practice that either enhance or impede well-being in our daily lives? These could be practices around leave or support for breaks during the day, those types of things. They can also be things like how we think about or how we ask questions around mental health and the seeking of mental health support in terms of when we engage those questions in licensure and credentialing. Those questions can either be stigmatizing or they can be supportive in terms of people getting the help that they need. A big one for me is this ease of work and practice efficiency. So I've been thinking a lot and have for many years about how it is we make work either easier or harder for ourselves and for our colleagues. What are the systems approaches and the workflows that we can put into place that actually make it possible for our incredibly talented colleagues to do their best work, that avoid redundancy, that avoid unnecessary work, and really move into that space of efficiency and meaning. And finally, but most certainly still incredibly important, how do we think about cultivating a culture of connection and support so that people have a sense of belonging when they come to work, that they feel that their team has their back, that they know who to go to if they're in a place of stress or challenge. And that recognizing that we also need to be really intentional about that it is in fact cultivation, and it doesn't happen just by accident, as it were. So that's the sort of roadmap, Carolyn, that we've been thinking through.
Thanks, Lee. I was struck as you were talking that each one of these 6 areas represents an opportunity for us to really impact workplace well-being. And you mentioned being really interested in ease of work. Is there perhaps an intervention that you're doing in this space that you'd like to share briefly?
We have had some incredible opportunities that I'm super excited about. We've had some within our office and some that are happening across the enterprise that I think have tremendous promise. The one that we've been directly partnering on within our team and within our office is a new workflow around prior authorization for medication specifically. And involves a partnership with the Department of Medicine and with our pharmacy colleagues to bring to that process for our primary care clinics in medicine a pharmacy technician who is specifically trained and charged with supporting the prior authorization process to make it more efficient and also more efficient, more effective, and also to free up the time of our clinical teams to do clinical work with our patients. And that has been really incredibly exciting to see. The pharmacy techs have been enjoying it because they have intention and purpose in their work and are really becoming very efficient at the work that they're doing in this space. And the clinicians are grateful to be freed up from this administrative time in order to really focus on their patients and on the care that they're delivering. That's been really exciting. There also is incredible work going on. We have colleagues in the Office of Johns Hopkins Physicians who are doing work on Epic and our in-basket workflows to help us be more efficient and more effective in that space, and other exciting work in the AI domains. But those are just a couple of things that are happening. But Carolyn, you've been doing some really exciting stuff too. Can you tell us a little bit about what you've been focusing on?
Well, thanks, Lee. Let me start with the thing that I'm sort of obsessed about right now, and that connects both to the leadership behavior domain and building that culture of connection and support. And that has to do with listening. Our sense of belonging really is informed by that sense that people see us, they hear us, we're important to them. And as much as we talk about communication competency in healthcare, a lot of that is in this space of, can I communicate well in writing? Can I be persuasive? Can I get information out? But that idea of, am I actually listening to you? Am I deeply listening to you to understand? And can I listen in a way that respects diverse opinions and holds space for ambiguity? Those are things that I'm really interested in. In general, I would say that the connection between providing support in the workplace and the leadership behavior is around the kind of practice environment we work in. And if we create a practice environment that is healthy, that is positive, that is respectful, that tries to minimize these pebbles in the shoe and the boulders on the shoulders, then we're likely to not only get better outcomes, but we're likely to create a space in which people can not only survive, but they can thrive and feel professionally fulfilled. So my work is in that. And as I've teased you, I say that I'm always looking for buy one, get one free strategies. And we have to focus on leadership development. We have to focus on team connection and team support. And so when we invest in this work that supports deeply relational and effective leadership and a culture of connection and support, then not only do we get enhanced well-being, which is our primary intention, but we also just get better leadership and better relationships in general, and those drive everything that we care about in healthcare. Lee, obviously we'll focus on each of these areas in future episodes, but is there anything else you think we should highlight today in this introductory podcast?
Gosh, such a great question, Carolyn. I think one of the things that has been top of mind is thinking about how we can use policies to influence the outcomes we're interested in ways that feel supportive and not overly directive. And I think there's a real nuance here that's important to get at. We can create and implement policies that directly influence health and well-being. Those could be policies around a smoke-free workplace. We dictate that there is no smoking on campuses, and that directly impacts lung health and other aspects, and cardiovascular health and other aspects of health. But there are also ways in which we set up and structure our systems through policies and procedures that are maybe not explicitly well-being policies, but which we can approach with a lens of and asking the question of what influence or impact will this have on our colleagues' daily experience of their work? Can we bring the lens that says in anything that we do and everything that we do, around setting expectations and appropriate boundaries or appropriate guidance for our work, can we take to that conversation and to the decision making and to the implementation around that a goal of creating environments in which people thrive? And that's gets a little bit at sort of, it could be a positive hidden agenda, as it were. But I think it's really critical as we think about how we shape the culture and the environment in which we all work.
Well, I am excited to be doing this work with you, Lee, and to have the gift of the time and skills of so many of our colleagues around the health system who've been allies in this work with us.
Absolutely.
Well, we've got a lot to talk about over the coming months, but to wrap up today, I'd like to share our 3 takeaways from our conversation. The first is that self-care is very important for well-being, but focusing on individual behaviors will never be enough to improve our well-being at work. We have to be looking at organizational and systems level strategies. The second is that because well-being is foundational to our ability to achieve anything that we care about in healthcare, whether that's safety, quality, professional fulfillment, professional growth, or frankly, our readiness and ability to deliver safe, excellent, person-centered care, we have to prioritize well-being at the organizational level. And also, finally, like anything we care about, there are no simple or quick fixes. But the good news is we do have guidelines and we do have an emerging evidence base to guide us. So we look forward to discussing some of these with you as we continue our conversations about well-being at work. So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email your ideas to us at owb@jhmi.edu.